Taiwan last week saw a surge of people returning from overseas as COVID-19 intensifies and the pandemic worsens.
Fearing a spike of cases in Taiwan, the Central Epidemic Command Center announced a change of policy for the 3,000 people who entered Taiwan from the U.S. and East Asia in the 2-week period between March 3rd and 18th.
If any of them has developed any symptoms of COVID-19, they must immediately self-quarantine and refrain from leaving home.
On Saturday, 18 more COVID-19 cases were confirmed, with the influx of people returning from abroad. The Central Epidemic Command Centre could not afford to relax its vigilance.
We are highly concerned about nations where COVID-19 is rapidly spreading. People who came from the U.S. and East Asian countries will be recalled to home quarantine and tests will be arranged. They number about 3,000.
The government is urgently tracking down those 3,000 citizens and tourists who entered Taiwan from the US and East Asia between March 8th and March 18th and sought medical treatment. They were originally asked to undergo self-health management. Now they must undergo home quarantine and not leave their houses while they wait to be tested for COVID-19. Even if they do not receive a notification from the government, they must report to the authorities. Of the 18 new cases announced on Saturday, 14 were aged under 40. And when taking a look at the total of 169 confirmed cases in Taiwan, more than half of the patients were aged under 40. Is there a trend for younger people to contract the virus?
There isn't a trend of younger people getting infected more than before. It's this particular batch of returnees. They are comparatively younger.
Chen stressed the reason for this is that last week most of the returnees were international students taking refuge in Taiwan, meaning that young people would naturally form the majority of cases. However, the WHO's Secretary General has also sounded a warning to young people.
I have a message for young people. You're not invincible. This virus could put you in hospital for weeks or even kill you.
Although we say young people are less likely to have a severe illness or their infection rate is lower, they do have a certain chance of catching COVID-19, so pay close attention during this period. Young people with a recent travel history should not be roaming around.
Experts have called on active young people to do their utmost to stay at home, to reduce the risk of infection for themselves and their families.